I wanted to walk you through a normal, typical regimen that I have my patients use for their own skincare. This is also what I use. I want to just kind of explain the steps on how to use everything. It can be confusing sometimes, wondering where do I put my prescription, where do I put my toner, where do I put my sunscreen. So I wanted to just go through and show you guys what I do, so it makes it a little bit easier. So I've already exfoliated my skin, so I used a hydrating cleanser. I massaged it into my skin and I removed it after 20 seconds. Then I used a nice polish to just kind of buff off and gently smooth the dead skin off of my skin. At this point, you want to use your toner. So there are different schools of thought. Different people have different opinions on why to use a toner. My favorite reason is for the stability of your skin. So after we wash our face, we have an uneven pH. It's unbalanced on our skin. And when we're starting to use our ingredients, our prescriptions, our topicals, what's going to happen is that if our skin isn't toned, it's not going to be able to absorb all of those ingredients properly because the skin will be unstable. So that's the job of a toner. A toner's job is also to just get rid of any makeup or dead skin or dirt that the cleanser maybe left behind. So these are one of my favorite products. These are the Complexion Renewal Pads by Zio. They have a little bit of salicylic acid to help exfoliate, but they also help just, give your skin like a nice bright glow, and it helps with oil control. So that's what you would do as your third step of the day, your step following your cleansing and your exfoliation. So we're gonna let that dry a little bit. The next step is a prescription if you use one. I'm not currently on a prescription. Some of my acne patients use things like Axone or Onextin, or if you have eczema, there are other topicals to use. So those would always go first. You wanna make sure that your skin is absorbing as much of those ingredients, prescription ingredients, that it can. So that would be your next step should you be using one. Then you wanna put your serums on from thinnest to thickest. So I have a vitamin C. This one you can tell it's in a dropper, so it's very thin. And I'm just gonna gently massage it into my skin and apply it all over my face. This one's great because it has antioxidants. It helps prevent and protect free radical damage, which is basically premature aging from the sun. And it helps kind of give your skin that extra boost that it needs with peptides to help with fine lines, wrinkles, and just overall health of your skin. So then I would follow with Daily Power Defense. It's my holy grail favorite go-to product by Zio Skin Health. There's also antioxidants in here. It's a little bit thicker than the SkinCeuticals C Ferulic Serum, but it's great for the strength of the skin. So this is really going to help increase the barrier function of your skin. It's going to help keep your moisture in your skin and allow it from getting overly dry. Thickest cream is last. So I have the hydrating cream. This one's awesome. And it's just going to go on top. So people kind of ask, where does sunscreen go? Like, where in my step should I put it? And I like to give a little bit of an example. So think about, you have just cleansed and prepped your skin. You have it ready to put on whatever you want to really have your skin absorb it. So first things first, you put on all of your skincare. Your makeup is not included in skincare. Your makeup is separate. So skincare in the series that we've already talked about, and then you're going to put on your sunscreen. So I do have sunscreens that have primers, which is great if you do wear makeup because it's going to act as sunscreen, which is the most important function, is you want the protection. And then it's also going to be a step to prep for your makeup, so you're not putting on a ton of other product before you even put your makeup on. So you would do your sunscreen, and then you'd apply your makeup. At nighttime, your routine is pretty much the same, except for with sunscreen, you obviously don't need to sleep in sunscreen, but you do want to use a retinol product. Skin Better Science makes a really wonderful one called Alpha Ret. If you're one of my patients, you probably have heard of it. And that will go on at nighttime before bed instead of your sunscreen. So layering process is very similar. I hope this is helpful to you guys. And I will just tell you that when you come in and I create all of the different routines for you, this is what I put it down on. So we get to see your morning routine, the order that you use everything, at night the same time. So I think it just helps you understand a little bit more what you're using, why you're using it, and it makes it easier to know how to use it.